With regards to the DRAGON-01 trial, there are a few things to consider. One, the approach to the normothermic intraperitoneal chemotherapy, the bidirectional approach of IV and IP Paclitaxel. There is a period where the patients are given this therapy, and in selected patients in whom there is a complete disappearance of peritoneal metastasis, they were also taken for surgery, which was conversion gastrectomy is how the authors call it. It's a gastrectomy plus D2 lymphadenectomy. Now, they continue the chemotherapy right after the surgical procedure. So the patients actually start this treatment 3 weeks after the surgical procedure and continue that for as long as possible. So that's a significant design that needs to be taken into consideration when we think about our own trials in the Western cohort of patients, because there's a lot to unpack there. That's a study from Singapore, and it's a single institution study. It's retrospective analysis of their data thus far over the past 8 years. And it's a small study. It's 42 patients, and of the 42 patients in whom bidirectional intraperitoneal chemotherapy was used, about 10 patients were able to undergo cytoreduction, and they also used heated intraperitoneal chemotherapy with cisplatin at the time of cytoreduction. Now, although retrospective, what it shows is that there are different approaches to managing gastric carcinomatosis across the world. One randomized control trial where they are doing conversion gastrectomy after bidirectional therapy, another in which after bidirectional therapy, they are selecting a small subset of patients for cytoreduction. These two are different surgical approaches. And also to note that in this study, from the Singapore study, they stopped the therapy, intraperitoneal chemotherapy, after the surgical procedure. Again, a difference between how different areas or different geographic regions and practitioners manage gastric carcinomatosis. I think from that study, what I gleaned is that there is a patient selection that they are doing in terms of selecting patients with low burden disease and better biology to proceed with surgical resection, and those patients tend to get better outcomes. That is what I took away from the study, acknowledging patient selection after bidirectional therapy to proceed with surgical resection would be important to achieve long-term overall survival benefits.